Many reports estimate more than 60% of pregnancy-related deaths in the U.S. are preventable.
At the beginning of the pregnancy, it was, very normal. I, had normal cravings and, the normal weight gain.
And the normal excitement that comes with being a first-time mom. Alicia Curran-Moore and her husband couldn't wait to meet their son Mason. But when she was about 30 weeks pregnant, things went downhill fast.
I started to have some rapid weight gain, increased blood pressure that lasted for a longer period of time, headaches.
Her husband eventually took her to the hospital, where she collapsed and started having seizures.
Because my body was just not being able to handle the pregnancy.
After an emergency C-section,
he was born at 3 pounds and 3 ounces. He was about 6 weeks early.
Mason was taken to the NICU, but the doctor was having a hard time stabilizing Curran-Moore.
We came back out and talked to my husband and just said, I want you to prepare to be a single father because I'm not sure if we can save her.
Childbirth almost killed her.
Every year around his birthday, I always kind of think about it and think about how things could be different.
Curran-Moore could have been part of a stunning statistic. The United States has the highest number of pregnancy and childbirth-related deaths in the entire developed world.
Unfortunately, maternal mortality has been climbing, not only in the nation, but also in Oklahoma the past few years. In fact, in the last 9 years, it's increased by almost 50%. In Oklahoma.
And the outcomes are even worse for women of color.
Black women are 3 to 4 times as likely to die after giving birth, and also our Native American population has an increased risk.
The Oklahoma State Department of Health formed a maternal mortality review committee to investigate the deaths in our state.
We're looking for system-level changes that we can make in order to improve the health of women and their babies.
But it's still not clear exactly why more moms are dying in Oklahoma and across the nation.
You would think in the United States, with our sophistication of our healthcare system, that we would not have this issue.
Chronic conditions like cardiovascular disease, obesity, and high blood pressure play a big role in maternal deaths.
Seeing a healthcare provider and identifying any health conditions and getting them under control before you get pregnant is the number one message, I think, that we want to get out to women and their families.
Access to health care is also a factor, especially with several rural hospitals closing in Oklahoma in recent years.
We do rank low or in number of providers per women, both in the specialties and in primary care.
Healthcare leaders say raising awareness about the potential dangers of pregnancy and childbirth is key.
We know that 60% of those deaths occur in the postpartum period after birth, either immediately after or within 1 year of giving birth. So we are educating women with what we call post-birth warning signs.
The information isn't meant to cloud the happiness surrounding a pregnancy.
I don't want to be the Debbie Downer at baby showers sharing my story, but at the same time, I think it's valuable to share.
So more moms can live to see their babies grow up. The two most preventable causes of maternal mortality are hemorrhage and severe hypertension, which is called preeclampsia. Rapid weight gain, high blood pressure, severe headaches, difficulty breathing, and bleeding can all be symptoms of pregnancy and childbirth complications. If something doesn't feel right, always let your healthcare provider know.
Caroline, thank you. Just a few weeks ago, President Donald Trump signed a historic bill aimed at reducing the rising maternal mortality rate in the U.S. The new law authorizes $60 million over the next 5 years to go towards prevention. The money will pay for maternal health review committees in all 50 states to collect data on what is killing women during and after pregnancy and childbirth.
Well, we're talking about some rain coming in. This is going to be starting Thursday night into Friday morning as low pressure moves from the southwest up towards the north.